in News 24. And the main allegation was that myself as the Minister of Health am covering up on 1.2 billion rand corruption which happened in the Northwest Province, and that as a consequence of that cover-up, I have suspended an official in the Department of Health. The said official, this was contained in a question which was submitted on the 1st of September to the department and my office, and it's related to a tender, Northwest Department of Health 44/2019, which was a tender for physical security. As you would know, that because of the various security problems, our departments to protect hospitals, especially clinics and offices, we have to acquire security. Some provinces use a combination of full-time internal security and also external private security, but most of them use private security. So this relates to that tender of 2019, and the said official is a gentleman by the name of Advocate Maile Ngage, who is the Chief Director. This is what was alleged in the statement, and that I am hiding a report which Advocate Ngake has compiled, and that, but following on that, from not just hiding the report, but I have also suspended him because of him exposing this corruption. Now, for starters, when he came to me and said, "There's this matter," I said, "Well, I don't know anything about what is it," because I had never. I mean, I've been aware quite some time that there was a problem in the Northwest with a tender for security quite a few years ago. I think starting from the time when I was a deputy minister, became aware that since the province of Northwest has been under administration from 2018 until middle of last year, in the process of that there was a problem with the tender for security. But what I was aware was that the matter was taken to court, and that there was a court ruling on the matter, and that that tender had been set aside by the court, the High Court in Mafikeng. So this issue about me covering up, hiding something, was rather very foreign to me. So the team then started trying to find out exactly what this matter is about, and of course I came to also be aware that Advocate Ngake was suspended by the DG. Now, Advocate Ngake is our head of labor relations and sector bargaining. He is the representative of the department in the Public Service Bargaining Council, and I did inquire, and the DG explained the particular issues which have nothing to do with this matter anyway. I mean, as I say, this particular matter of allegation that I'm hiding a report and I've suspended him was rather foreign to me. So in then going deeper to find out what is this about, what we have subsequently found out is that what happened is that when this particular tender was issued, it was at the time when the Northwest Health Department was under a Section 101B administration. As you might be aware, that about 6 departments in the Northwest were under Section 101B. They were all departments, including the Premier's office of the Northwest, were put under administration in 2018 by Cabinet and approved by the National Council of Provinces. And out of those 6 were under there are 2 provisions of administration. One is called 1B, the other one is called 1A. Now the 1B, 6 departments, which included health, means you then appoint an administrator to run that department. The rest of the staff remains, the MEC is there, but the head of department of that province, provincial departments, is not the accounting officer. The administrator who's appointed by the minister becomes the accounting officer. So Ms. Jeanette Hunter, who is the Deputy Director General, was appointed by Minister Motsoaledi to be the administrator. So what then transpired is that there was a tender of this physical security, which I've explained background of why provinces acquire private security. This tender was the number of bidders, over 100 bidders, competed for this tender, and then there were about 20-something who were selected and awarded the tender. Now, some of those who lost in the bid, I think about 6 companies, then challenged the province to say the basis, because when you, after adjudicating those who have lost, you are obliged to report to say didn't meet the requirement or what or the basis of which you chose. So they challenged the basis on which they were actually left out of the tender, and complained to the province, and then because of the administration, they also wrote a letter to, by then it was after the 2019 election, so the new minister was Minister Mkhize. So they wrote a letter to Minister Mkhize to complain also about that they are unhappy about the outcome of this tender, and that they believe, because the head of department must, even though you have committees which do the selection, at the end, the head of department must be the one who approves. So they then said that they are unhappy with the approval by Ms. Hunter of this particular tender. Now, Minister Mkhize then sent an email to the new DG. It was a transitional period that was in June 2020, just in the middle of the COVID pandemic. There was a acting DG, Dr. Anban Pillay, who was just exiting. Dr. Buthelezi had just started the beginning of that month of June. So you would then see that in the complaint letter, actually, it's addressed to Minister Mkhize, but it's also for attention of the new DG Buthelezi, and also stroke acting DG Pillay, because that was the transition. Now, just to put in context that we discovered, as we try to dig now, to say, what is this matter? What exactly is this story about this? Because all that, I was aware of is that the matter was settled in a court in the Northwest. So as we dig further, so we find that Minister Mkhize then wrote an email to Dr. Buthelezi, the new DG, and said, DG, copy, here is the complaint from a group called themselves Bokone Bophirima Business Forum. They are unhappy about the outcome of a tender. Please investigate. So the DG then referred the matter to Advocate Ngage. It was also not a formal kind of, usually in the department, some of these things you formalize through a submission where you write a formal, It was an email also, which said, Advocate, copy, here is the matter which comes from a group called Bokone Bophirima Business Forum. Please investigate, and report back to me in 10 days. Now, that email, it's dated 12th of September, 2020. So, and he said, report back to me in 10 days, because you wanted to find out also what exactly is happening. So after that, from what we have subsequently found out, Advocate Ngake appointed 3 officials from his own section to go and do the investigation. Now, in the midst of that, there was a subsequent complaint from this forum, complaining directed to Minister Mkhize that I think somewhere around August, to say we are not hearing anything about the matter, and that's when the minister then followed up with EG and DG, got Advocate Ngake to appoint somebody to go and find out what's happening. But in the midst of that, the same group went to court, to the Mafikeng High Court, and applied for the court to set aside this tender. In the meantime, what we have found out, the administrator, Ms. Hunter, together with the MEC and their team, because they had also received this complaint, they then appointed an advocate with an investigator to dig into this process of this tender. And within the department themselves, the administrator and the team appointed by the MEC, this advocate, they established that indeed there was validity in the complaints of some of the 6 bidders who were left out. That, for instance, some of the reasons was that they didn't meet the requirements, they didn't submit certain documents, and so on. But when that team investigated, they actually found that their complaints was valid, that some of the documents which were alleged to be not in compliance were actually there. So when the matter went to court, they then were advised by their own legal counsel that is not, you're not going to win this. So don't even oppose. So the MEC and the administrator then agreed that they were not going to oppose the application. So the court then gave an order. That was in July of 2020. Of course, in terms of the sequence of events, what sort of, because we're tracing this thing in retrospect, what is a bit confusing there is that, notwithstanding that the forum went to court, the department did not oppose, but they were still pursuing the matter with Minister Mkhize, because by August, when they wrote a follow-up to say where is the matter, they actually had got a successful ruling in July by the Mahikeng High Court to set aside the tender. And so the tender was nullified, and the court ruled on the 31st of July 2020. And the ruling was that the tender is set aside, and that the department should then re-advertise that tender, but that because the service can be left in the void, those who were already appointed should temporarily continue to provide the service, but on a temporary basis. But the whole thing should be reopened. So that's really when we try to dig deeper into the substance of this matter. Now, in the process, the administrator and the Northwest Department, because of the fact that they out of their own volition decided that because there was definitely an irregularity in terms of how this tender was handled, they are going to take action against some of the officials who have been involved in the adjudication and management of that tender. And amongst them, there's a certain Dr. Makubo. I'm not sure, I can't remember what his position exactly was, but this is the supply chain management. And Ms. Is it Maleka, who was also CFO, and amongst others. There were about 3 officials who they decided to suspend, investigate, and charge. And that's how then, as we came to know, this Dr. Makubo subsequently, after the charging, was dismissed in July of 2022. Now, that dismissal of Dr. Makubo, in fact, by the time Dr. Makubo was dismissed, we had exited the administration of the Northwest Province. At that time, Ms. Hunter's appointment as administrator ended at the end of June 2022, and Dr. Makubo was dismissed in July, end of July 2022, last year. And we do also have a copy of the letter of dismissal, which was signed by the MEC, the MEC for the Northwest, MEC Sambata. So Dr. Makubo then, after being dismissed, then of course it took steps, which is where we are now, with CCMA. So the matter is with the CCMA. So I'm giving this background just in terms of context to understand what we have been able to find out. So what is clearly, and I hold no personal, vendetta or any gripe against the famous Kaya for his investigative. But what I can say, therefore, is that maybe just to tie the loose ends. So let me complete just the picture for you. So Dr. Makubo then get dismissed after being charged by the department in the Northwest. Clearly, at the time of his first being charged together with other officials, the administrator, who's a member of our management, Ms. Hunter, is still the administrator at the time. So that's when the initiative of the charging. And as I said, by the time when the process is completed and finally is dismissed, but by that time, Ms. Hunter has already left. Now, just to come back now to the substance of the issue which I am covering up. What is quite strange is that Advocate Ngake was appointed by the DG to do this investigation. And here we are just sort of tying the loose ends. And until when this matter comes, and we're all perplexed as to what is this, because all that we know, at least that I know, is that that matter, which was an issue in the Northwest, was settled in the High Court, and the tender was dismissed by the court and to be re-advertised. I have absolutely no clue about the fact that there was also Minister Mkhize had asked the DG to do an investigation. So DG also then, when we then find out, and that's the matter which the gentleman was following up, what we then find, because the inquiry, just for your purpose, just to complete the picture, was on the 1st of September, that Minister Phaahla, regarding allegations that the minister is covering up a 1.2 billion corruption in the Northwest Department of Health. Investigative report compiled by Advocate Ngake found gross irregularities, which was echoed by Auditor General and a High Court decision. 2 people which the report said should not be disciplined were suspended, including Makubo, and subsequently Advocate Ngake himself has been suspended. Now, what is strange is, as we then find out, is that Advocate Ngake's team did a report. That report was never submitted to the DG. And so as this inquiry comes in, that's when we try to find out, but what is this? And then we find that indeed there was a report which Advocate Ngake compiled. That report was found in the office of, in one file in the office of Advocate Ngake. Was never signed. There's a report addressed to the DG, also a covering letter, which I think it was also included in the court papers of Dr. Makubo as an annexure, which, you know, it speaks to itself, speaks for itself. It's a letter which addressed to the DG to say, here is my report on my investigation into the allegations in the Northwest. And then there's the report itself also addressed to the DG. But both documents are not signed. They are dated, I think, 12 October 2020, but both the letter and the report are not signed. Now, so as to, and my question then, fortunately the DG is still there. So my question to DG was, Minister Mkhize asked you to investigate this matter, and you delegated Advocate Ngake. Did you receive the report? And the answer was no. He never received the report. But the explanation was that because of the fact that the matter was finally settled by the High Court, he did not, even though Ngake did not submit a report as having been delegated to do an investigation, he never followed up on why there was no report, because the matter was in any way ruled by a High Court in the Northwest. But we do then find this report. But now what is interesting is the fact that even Advocate Ngake himself, we're talking about a report which he compiled in 2020. This is now 3 years later, in 2023. There has been I was appointed in August 2021. At no stage did Advocate Ngake ever come to me to say, Minister, I was once asked by DG Buthelezi to do an investigation. I did a report on this matter, and but you know, subsequently the DG never asked me to submit this report, and therefore the report is still in my possession. The matter only arises subsequent to Advocate Ngake being suspended by the DG on, as I'm informed, totally unrelated matter which is happening in the department. That's when this matter comes up to say, and I know that I think it was just a human error from our friend here, that although he referred to Advocate Ngake, some way down he confused it with Advocate Maleka. Yeah, but I think it was just an error. If you look at your question, it was just an error of Maleka instead of Ngake. Yeah, so we acknowledge the fact that it was Ngake you were referring to. So it's only 3 years later when Advocate Ngake gets suspended on an unrelated matter that this matter then arises, that he's got a report which he was asked by the DG to investigate 3 years ago, and which was never submitted. And then, of course, Dr. Makubo, who was dismissed, as I said, the letter of dismissal by MEC Mbata stated 31st or whatever of July 2022. So Advocate Makubo then applies the, what you call this act, PAIA. Yeah. Uses the PAIA provisions to demand the report, and that's where News 24 comes in, because he then applies for PAIA access and to say he wants this report. And of course, subsequently, when the report was finally found, because Advocate Nake was on suspension, but his team, the team who was working with him, confirmed that there was this report. They looked for it, they found it, they made it available to Makubo's legal representatives. And this was submitted in his court application. Now, again, just, I mean, I know that issues like this make very interesting reading for your readers. Now, on a subsequent follow-up by News 24, again, I believe quite unfair to me. It refers to a court ruling. If you read that report, I'm not sure if you can be able to access. I just want to read that report for the colleagues here. The report makes an allegation that, again, continuing that I have been covering up, and then says that the court has now compelled, and you'll see it in a number of, covered by a number of other media, that Minister Phaahla has been compelled by the court to act on a matter on which he has been covering up, relating to, I've got it, the report says that the Health Minister is spending his long weekend adhering to a High Court order for him to finally act on an investigative report that detailed massive corruption. Phaahla spent the year, according to court documents, ignoring repeated pleas for him to release an October 2020 probe that unearthed 1.2 billion graft. The Gauteng High Court ordered Minister to act on an explosive 1.2 million alleged attempt to conceal, blah, 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 blah. But if you were to read the actual court order, did you include it, Doctor? Maybe in the but if you read the court order, there's nothing about the Makubo applied to the court to say he had been struggling to get this. Of course, by the time he applied to court, he's got a copy of the report, but he then complains that the report is not being acted on, and the report is not formalized because it remained unsigned. So that's his application to the court. All that the judge then orders is the fact, the essence of it. I don't know if you are able to access the court order. There is a court order number 2. First of all, well, they said that the matter is removed from the roll of the court. That's order number 1. Order number 2 then says that the minister should make a decision about, well, the minister must reply to the court as to why the report has not been signed. It's not saying, there's nothing which says the court doesn't, there's no way it orders that the minister must act on the report. Order number 1 says the application is removed from the roll. Order number 2, the respondent is ordered to, in writing by no later than close of business on the 26th of September, explain what happened with the unsigned Northwest Tender investigation report. Explain why the report had not been signed, and adopt a final position. And they say in bracket, either accept the report or reject the report. And that is essentially the order, that the minister must explain in writing why this report has not been signed, and make a decision as to whether he accept or reject the report and submit this in writing. This we have done. I was out of the country at the time when the matter went to court, but as soon as I came back on Saturday, I was made aware, and on the 26th we duly obliged and submitted a response to the court. And the long and short of my response is exactly what I'm saying to you as well, to say that well, it's including also because now what is interesting is that even the applicant having copy of this report, which is addressed to the DG, does not even cite the DG either as a respondent number one or a second respondent. The only respondent on this application is the minister. There's no mention of DG, but he's got is attached to his application this report which is addressed to the DG. But nevertheless, so on the advice of legal counsel, I had to respond, and also the DG had to also attach his own response. But the long and short of our response to the court is the fact that we did find this report. This report was never formally submitted. It was never, even the author of the report never, sort of took ownership, because if you take ownership of any document, you have to sign it. And he never signed the report, he never submitted the report, and therefore, on my side, I've got no basis on which then I should accept a report which even the author never signed it and submitted it. But also that the gist of the matter was in any way adjudicated by the High Court. And once the matter was adjudicated by the High Court, it does not become a matter for me. So the long and short of the matter as I look at it is that you've got the aggrieved, two people who are basically aggrieved and who are trying to find somebody to blame, and also possibly hoping that by deflecting the issues on which they must deal with to the minister, it may then possibly put pressure on the minister to intervene, to say whether, especially in terms of the gentleman who's in my department, Advocate Ngake, possibly, to put pressure on the DG to say, because it is now alleged that his recent suspension, which I am informed has got nothing to do with this matter, that possibly by putting some allegation on myself and claiming that the reason why there is action on him is because of his 3 years ago report. By deflecting this matter, hopefully I can then feel the pressure and put pressure on the DG to say stop everything on this gentleman, because otherwise, he's putting us in bad light. But I can't do that. I can't do that because, first of all, on this matter, which is being bandied around, as I've explained to you, I have absolutely no qualms about the fact that there is nothing which has been, covered up. The people who are being charged by the Northwest Department have all legal opportunities, like Makubu has done. He was found guilty, he was dismissed, he took the right step. He went to the CCMA, he is still with the CCMA as he reported to the court. The matter is going into arbitration on the 2nd of October. I think he says between the 2nd and the 4th of October. So he's got all the opportunities which are provided to all citizens, and in terms of our labor relations. So if he has information, including some of the allegations which are contained in Advocate Ngake's report, which, as I say, he believes that report can help him if it can be signed. It can help him at the CCMA, and is basically asking the court to compel me, either myself, and I don't know how somebody's report, how I can then go and sign it so that it helps him in the CCMA, or whether I should then go and compel Advocate Ngage to sign that report so that it can then go. But at the end, he's got all the rights, even having access to that report signed, I mean, as it remains unsigned. If he believes that he can use it in the case in the CCMA, he's got all the right. He's got the report. He can use it if he feels so. But just in terms of, because that's also a public document in the sense that it's now been submitted to the court. In that report, Advocate Ngage makes very serious allegations against the then administrator, that she was also guilty of not properly, handling the issue of that tender, and therefore that she also is a person who must be, taken for consequences. But what is interesting is that, I mean, notwithstanding its status, in the report itself, while he quotes interviews which he's had with the other officials, including Makubo, nowhere in the report does he even claim that he did interview the administrator. So he makes a finding on very disparaging findings against Ms. Jeanette Hunter, who was the administrator. But even in the report, while he can attest to having interviewed other officials, there is nowhere where he actually even claims that, this is what Ms. Hunter said when she was also interviewed. And so it becomes clear that, I mean, there's some term in the law, what do they call it? Here the other side. What do they call it? Outer pattern. So even in terms, and that's a very basic natural justice in terms of any matter of investigation. It doesn't, even in that, there is nowhere where the advocate claims that he did give a chance. So basically my conclusion of this matter is that we are dealing here with officials who are aggrieved because of, one, it is a related matter in terms of the gentleman, Dr. Makubo, who approached the High Court. And as I say, we have complied with the court order. We have written to the court and explained, myself and the DG. The other aggrieved party clearly is Advocate Ngage, who believes that, as alleged here, that his suspension has to do with this particular matter. And now, what is also strange, I mean, Advocate Ngage is a specialist in labor relations. He's the man who represents us in all these matters. He knows himself, because I think there is no way in which the journalist can make allegations that I'm the one who suspended him without, even though he didn't say he had it from Advocate Ngage, but by the allegation that I suspended the advocate. It can only, I assume, come from him. But he knows he's got the letter of suspension, which I have not even seen. But the DG has confirmed that he has suspended him based on particular allegations. First, he knows he's got the letter, which there's no Phaahla there in that letter. But I believe that it is in some way a deflection of the matters to try and deflect the attention from the issues. Maybe let me stop there after my long story. I hope it makes some sense, but Doctor, I'm sure you are the conductor here. You will help us in terms of the
thank you, Minister. Colleagues, I think Minister has laid down his story. As we agree that that will not be the only area that you should ask him questions on. the engagement is open for questions on other health-related matters, but that is the subject that the minister wanted to clear out. The conversation with him is not going to be, it's an unmitigated one. So you would introduce yourself and then ask the question, and then the minister will respond to the questions. Let's do it in that way. Kaya.
I can go.
Yeah.
Just so we can clear it up, Advocate Nake is, in fact, it's unfortunate that he might be in trouble for my stories. He only came up when I was tracing who actually did the story to find out that he was suspended. So he's not the one who told me this thing. I had to ask him for comment because I couldn't get hold of him within the department. As you said, here the other side. So hopefully this doesn't get him in trouble. You can check his communication. He had never contacted me at all. I was always contacted him. That's one. On two, you say the report is unsigned. I get that, but there's an AG report. You touched on it a bit, which also sort of echo some of the findings that Advocate Nake made, forgetting the fact that he didn't sign the report or the report was not signed, including the fact that there were bidders, or that there were recommendations that the bidders who were put, there were bidders who were made successful who were initially unsuccessful, but they were handwritten, their names were handwritten on the final successful bidders list. It made also that the people who handled that bid adjudicating or evaluating committee and the BACs should be investigated. Nowhere was Makubwe and the CFO at the time, who's now, I think, also suspended, Betha Malika. They were not part of the people that the AG said must investigate. My question then is, forgetting the unsigned report, forgetting that there was a High Court order, there's still the AG report that is saying that there must be investigations and certain irregularities that happened. And whether you were the minister before or the minister now, you are the minister now. It's not the minister of Zweli Mkhize or minister of Dr. Joe Phaahla. It's the minister of health, and as the Ministry of Health and as the responsible department at the time during Section 100, are you saying that because you were not around, that because the report was unsigned, all the allegations that came out, including from the AG, you are not going to take the matter further?
Well, the matters which are raised, there are procedures. The matters which are raised by the AG, as I've said, there was, the report becomes part and parcel of the departmental report to the legislature. So that matter goes to the Northwest Legislature, and it's up to the legislature also to if there is any further follow-up. I mean, the legislature is at liberty to can call anybody who's implicated in terms of the Auditor General's report to can give further account. So, one may, further inquire from, because you would know that besides the portfolio committee, there is also your scoper in each province as well, which follows these matters, especially Auditor General's reports. They are followed up by the scoper. So one would have to check as to whether, because those reports do go to those committees, whether there was any further steps which were taken by both the portfolio committee of the province, but also what is the full name for the scoper? Standing Committee on Public Accounts, yes. Those are the committees which, once the Auditor General's Auditor General makes a report, then they will follow up, and once the scoper would then call on the MEC to make sure that particular steps are taken, and it's a matter which one can follow up with the committee in both the portfolio committee and also the standing committee on public accounts to check whether there were any further steps in terms of the Auditor General's report. But that's how the process works.
No, I was asking that question because, as you said, the province was under administration.
Yes.
And so in the administration closing report, that Ms. Hunter detailed that the Auditor General had made these recommendations, and because the department, the national department that is, was a custodian of health in the Northwest at that time, was that included in a closing report that the Auditor General said these things need to be investigated. That's one. And then the last question that I'm going to have is in the court papers that you're speaking about, in the court filings, there's a series of letters that were written to your office and were received and signed for by people in your office, in your legal department, in your personal office as well. I'm not going to mention names because there are certain people in your department who are sending lawyers' letters to me right now, so I don't want to. in which court? The Makubu case, that is.
Okay.
In the court filings, the things that he has are emails, including a sheriff's letter that came to you in May. I think it's the 17th of May. My days are mixed up, and of this year, and it was signed for by people in your office.
When you say in my office,
in the office of the minister.
Okay. In terms of admitting that they've received.
They've received.
Yes.
There's returns of services and all of
Yeah. Yeah. No, they have to argue. When the sheriff comes, that letter you have to accept the fact that the letter has been received. Yes.
Beside and including the emails that were sent to your office, are you saying that you never received any of those and knew nothing about them prior to my media query on September the 1st? Well,
when we receive a lot of legal documents almost on a daily basis on various matters, and generally, I mean, whether it's whatever the subject matter, there is a particular procedure. Most of those will be either addressed to the minister or they will be addressed to the DG. So when there are particular procedures in terms of how those get handled, we do have a legal department. So if it's legal issues, if it's a matters which, for instance, are going to go to court, the legal department would, first of all, you have to acknowledge receipt, and after that, there's a particular procedure in terms of the legal department would then have a look at it and determine whether, for instance, whether there's got to be a response in terms of an affidavit or whatever, and whether the matter has to be referred to the state attorney. For instance, most of the time when there are legal issues, our legal department, like all other government departments, has to function through the state attorney's office. So they would then take those steps, and by the time when it comes to me, it would be when the matter has been processed in terms of whether, for instance, there's got to be an affidavit, like in this case, once the matter becomes a court matter. So not all, because I can tell you, even today you will find there's a litany of various issues, whether it's on personnel issues, on procurement, or on any other matter. There's a litany of legal issues which come to the department. That's why we have a legal department. So it will be addressed to the minister, but it will then be forwarded to the relevant people. And it's not only legal matters. They are, ordinarily when members of the public communicates with the department, what they know is the head of the department is the minister. So those correspondence will be addressed to the minister. So they don't all come. Otherwise I would spend the whole day going through those documentations. That's why you have people who will then process and only at the appropriate time when it becomes the matter is matured. Like in this case, the matter is now a matter of a court. They've consulted with the state attorney, they've reached a particular stage, and there's a particular, so when it comes to me, it comes with a particular recommendation to say, and if it's a matter which whether legal or other sections can actually deal with without necessarily coming to me. I mean, in this case, the issues around the demand for the report was finally, I mean, it was, once the report was accessed, it was submitted to Makubu's lawyers, and it didn't have to come to me, you know, because the matter has been dealt with.
Okay, and on the closing report from Santa?
Well, in terms of whether there was reference to the Auditor General, remember that the closing report would be, just take the steps. This matter is a 2020 matter. So it would not be, the closing report would be when she leaves as an administrator, which is now 2022. So the matter would have been settled in the High Court in 2020. So possibly maybe in the annual report of 2020, maybe there might be reference to that. It's not in the annual report. So then that would be the question. But it's in the Auditor General report of 2020, because this matter, remember, the government functions on financial years. So a matter which happened in 2019 up to 2020, it would then be, I would assume that the Auditor General's report would be a 2020 report. So that is the report which would contain this matter, because the procurement process happened between 2019 and 2020. So, because the annual report would be a report submitted to the legislature at the end of April, the end of the financial year 2021. So that if it's got to be in the report, it would be the annual report of the end of the financial year ending 2021, which will be August 2021. If it is in the report, so it would not be in the because just like, remember, the administrator is like any other head of department. They've got to submit reports on the annual financial year. So the final report of 2022 would not include a matter which has been dealt with in the financial year 2019, 2020, and 2020-2021. And I'm not sure which one you're referring to.
No, that wasn't the question I was asking, but it's fine. I'll leave it up to the colleagues and ask for time afterwards.
Okay. Yes.
Hi, Minister Stephen Masina from eNCA. I first wanted to ask you with regards to the water crisis we're seeing in many parts of Gauteng and perhaps across the country that have affected hospitals. We do know, as far as I understand, as of even yesterday, hospitals like Wahima Musa are still struggling with water. Are there any concerns about infections and diseases and breakouts within these hospitals, and is there any action or oversight that the department is doing? And can we get an update with regards to the cholera outbreak that we saw earlier this year? Where are we with that? Is it over? I see we're not getting updates anymore. Also, regarding the change in uniform for nurses, there's obviously been some criticism from some organizations. Where are we with that?
Okay.
Will you be perhaps reviewing this new dress code?
Are you considering some of the criticism around that? Yeah, I think for now, those are the three, then I'll come back. I think I just have one more.
Well, the water issue is indeed a serious concern. Now, you know that the hospitals which are mainly affected, Rahima Musa, Helen Joseph, because of the whole issue around rainwater and the supply, which also includes the issues of load shedding, the pumping of water. So the approach there in terms of, I mean, they do get water tankers, but that's not enough in terms of, as you said, including from infection control. So what working with our infrastructure team, we're looking at a prioritization for the, all provincial departments have access to infrastructure funds, the conditional grants for infrastructure. What we have been doing, for instance, with load shedding, is to say that where there is possibility, and so I'm linking the two because those are two key issues, water and electricity, that where there has been an indication by either ESCOM or the Electricity Supply Authority that certain improvements can be made in terms of cabling, for instance, to separate health facilities, they should include in their business plan for access to infrastructure fund, such funds which will be able to assist to separate the health facility from the surrounding community. Equally so with the water issue, because the long term is to make sure that there is sufficient water, what do you call them? Your storage, the storage facility. Some of the hospitals like Charlotte has developed quite significant water storage. I think Charlotte can withstand, I can't remember whether it's up to 3 days with the storage tanks. I think recently when there was an upgrading of the stores, they also included increased water storage. So what we're encouraging them is that in the business plan for infrastructure, either from their own budgets or from the conditional grant, they should include upgrading of water storage. The question is whether, I mean, if you have, it probably would help for some time, provided you don't have prolonged, because even when you have a water tank which can last for a day, if the interruption or disruption of the water is continuous, then even your storage. But at least if you have some significant storage capacity, that will be insurance going forward. So we are encouraging them to look to invest in storage and include that in the business plan for the next round of funding from the conditional grants. Of course, what it means is that this then takes away funds which otherwise would have been used for other upgrades in the facilities. I mean, a facility like Rahima Musa and even Helen Joseph, for instance, requires many other areas of upgrading. So it means you're going to divert funds which would have been used to upgrade wards and others to allocate those funds for water storage tanks. But because it's quite critical, that's what we are encouraging the province to put, with the hope that there is also the layout of, remember these hospitals are quite old, In some of them, we may also face challenges that the layout may not have adequate space for putting up a major water storage facility. But hopefully that is not the case. So that's the, so definitely it is a problem. It is a matter of concern, and we would like to support the province with the necessary prioritization in terms of the infrastructure.
Can I just follow up on that to say, have you received any applications in terms of this funding as of yet, or?
It goes, no, you do that on an annual, so the business plan for 2023-24, so they are open for the next financial year. So that would have to come, but I'm sure, because our head of the infrastructure has been communicating. I believe that in the because the applications for next financial year, I think, will be starting soon. So one would expect that they will include prioritization of the storage facility in the for the financial year 2024, which will be allocated in in April next year. So that would come. The ones on electricity, for instance, I think some of those from the report which I got from, because the CFO, our CFO, who is the custodian for these conditional grants, has been working with them where it's possible even to amend the business plan of the existing. But there's also timelines as to at what time. If you haven't done the amendment by October, for instance, you can't amend. So as to whether, I know they have done some of them for the cabling, for the electricity supply, where there's indication that, but we can be able to confirm and follow up that they do prioritize the storage. Hopefully they have done the scoping and so on, and it is going to be possible to upgrade, the storage facility. We have not given any further updates on the cholera because there has not been any new cases now for 6 months? What is it September now?
I think so.
Almost October. No, not 6 months. I think we had the last case somewhere in June. Is it, Doctor? May. End of May. End of May, June. So, which makes it how many months now? For full 3 months. Yeah, there has not been any new case anywhere in the country. So that's why maybe we're guilty of not reassuring the country that there are no new cases. But definitely, whether in the Tshwane district, where there was the epicenter, whether it's in, is it Mwate? Means Mwate municipality in the, what is the district? Fezile Dabi. In the Fezile Dabi district, there hasn't been any other parts of the country, Limpopo, in the Vemba district, where there's been some isolated cases also there. So basically, for the last 3 months, we have not had any new cases of cholera. The nurses' uniform. The issue here is that, well, there may be a number of issues. Is that there's been an agreement in the bargaining council that, and I can't remember the date, maybe a year or two ago, there was an agreement that we should move from the nurses' uniform, what do they call it, where it's included, allowance. Because the process up to now has been that nurses get an allowance for uniform. And the change now was that government should buy the uniforms. And that was agreed. And there are some issues which then we had to deal with, because there is the question of the standard. And as far as I know, that is agreed. It's a white uniform. Then, in terms of implementing that, it's a matter which is going back for further discussion, because the initial agreement was that it should be implemented from October this year, but it was not practical. I mean, we discussed it in the National Health Council with all the provinces. The preference of the unions was that it should be implemented on a central basis, on the national basis. In other words, the uniforms should be procured nationally and distributed. But we said it's practical, it's not very practical. I mean, you know, the actual employers of nurses is the provinces, and even in terms of logistics of, you know, how many nurses at Baragwanath, at Siloam Hospital in Limpopo, it will be cumbersome for as an office in Pretoria to procure all those uniforms and distribute them. I mean, we could do vaccines, but you know, it's a different thing, uniforms, to distribute the size and so on. A vaccine, it's something which, you know, this is the measurement and so on, it's gone. But there are so many variations in something like a uniform. So we said, and we discussed it with the provinces and agreed that that allocation should go to provinces. And of course, I know a union like Dinosa has written to me unhappy that this matter is going to be, that there will be differences in implementation if it's done at provincial level. But we then pointed out that just from implementation logistics, it could be a nightmare. So that's one aspect which also is a matter of further discussion. The other aspect, of course, it's certain specifications of the dress code, which goes with that, which deals with whether certain, what do they, attachments, like your traditional things of twasa or twasa, whether somebody can wear some of, and then I think of religion and other issues, which also then came into the picture. But some of those things also have to do with what you mentioned earlier on, issues of infection control, what is required. I mean, if you work in ICU, if you work in theater, for instance, when you get into a theater, you know, you change your clothes, you leave your clothes somewhere. I mean, there's a room where you must, including your watch, your ring and whatever, it's stored somewhere. So it's assumed that if you have, for instance, what do they call spatla? It's called spatla.
It's pandla.
It's pandla. It's pandla. That you can leave it where you change, but not go with it into the ICU. Sorry?
It doesn't come off.
It doesn't come off.
You can't take it in and off. You can't take it on and off.
It has to follow.
It has to follow culturally. It has to come off on its own.
So the problem will be, for instance, if you have to go into a theater, because, as I say, even rings and watches, you leave in the room where it's locked, and then you go in, do the operation, and then come back and get your things. So those are things which I know they are becoming, and I don't know why they are rising now, as they are included in. But these are things which have been there all along, you know. So why they become an issue now, I'm not very sure. Yeah, that's something which one still has to find out why they're becoming an issue, because it's been, you know, in terms of the infection control requirements. Those are things which have been there.
So for now it's on pause.
But
You paused. It's going back for review.
well, I'm saying some of those issues, I don't know why they arise, because even now you can't go. There are certain parts of the hospital where you can't use your things, whatever, because, as you say, if it means, I'm not sure whether people who carry those things, in other words, then there are certain parts of the hospital where they can't go in. one would have to, I just saw that it's becoming an issue now. And why it becoming an issue when those requirements are not new? One has to find out. But what is going back, it's the timelines, because the team, our teams from national and provinces have reviewed the timelines that it's not possible to implement the purchasing and distribution by October, by next month. And the provinces have requested that we go back to the council to discuss that it be implemented next year, so that make sure that in other words, the allowance then will continue, and then the actual distribution of uniforms will only come in September next year. That's the timelines which have been requested by colleagues who are involved in the implementation. Those issues of these cultural matters and religious will have to be rediscussed, but as I say, we're compelled by some of the requirements in terms of infection control measures that those things must be taken care of.
Mark?
Minister, I have to leave it at 11 o'clock, so excuse me when I step out, but just a couple of questions. Are you concerned by the austerity measures that are being required by the Treasury on all departments and the impact that they're having on public healthcare services? And what are you doing to try to protect healthcare services? Because I'm hearing from doctors and nurses that it's a serious threat to a whole range of programs. So that's the one question. This may be a big question, but I'll just ask one other. On the question of the vaccines and the pricing of vaccines and what has been revealed about the excessive pricing, prices we pay, why did you not use the powers that you have as the minister and the government to negotiate reasonable prices for vaccines and to push back against those companies? So just those two questions.
Well, thanks, Mark. The issue of what you call austerity measures, well, maybe is the right term, the cost containment, that might be a more friendlier term. It's a matter of concern, definitely for us, and we have raised this continuously, even before the current, circulating kind of whether you call it instruction. I was told yesterday that the Treasury has amended the language from instruction to advice. So it's now been termed advisory rather than instruction. But it remains a matter of concern because health is a very sensitive area already, as we know. Public health is under a lot of pressure. Just the burden of disease, because that unfortunately health comes at the tail end of socio-economic difficulties. When you have high unemployment, high levels of poverty, including high cost of living. We came out of COVID. Well, there was the COVID. It itself put a lot of pressures as we are recovering, having lost, ground on key services. On HIV and AIDS, lost to follow up, TB. We tried to, we had to come with recovery plans to, get people back into treatment. Even things like immunization. And that's why you had, measles outbreaks, because throughout that 2.5 years, there was not enough vaccination, except we were focusing on the COVID. So there are all these programs which we have to now push a recovery. But also the socio-economic situation means that you have a lot more pressure. I mean, mental health has just, mental health issues have really just exploded. I mean, young people on substance abuse. So there's pressure everywhere in the country. Young people who feel, every day in the casualty departments. So there's all that kind of pressure. So for you to be able to contain that, obviously you need significant, financial resources. So anything which speaks to cutting expenditure in the health area, it's a red flag. So we have made that quite clear that, and of course, one says that while also as being part of the cabinet collective, you get a sense of the pressure on the fiscus, low economic growth, which affects revenue collection. So we have been speaking, even before this, with regular engagements at the administrative level, the DG, the CFO, with heads of treasury. I've also had regular engagements with the minister on the risks of any of this. With this advent now, where as I say, I mean, even though the language has changed, just yesterday I was sitting with the senior managers going through what has now been, how do we respond? Because at the same time, we do understand that and we hope that it's temporary in terms of just protection of the fiscus. We hope it is just hopefully a temporary situation and things will improve. So we have sat down and looked at where we can make a contribution to the pressure on the fiscus without significant risk. So what we've been, just as I said yesterday, I was just sitting with the senior managers, including the DG and the Chief Financial Officer, looking. So where we have said we can make a contribution, it's on issues which, to a large extent, would not significantly risk the services. But there are, of course, some areas where it will be. But we're looking at things like cutting down on traveling, doing more, if there are meetings, be virtual meetings. Just as an example, and the doctor in Foster can confirm, sometime a meeting like this we could be having somewhere in a Hyatt venue. But because of adherence to what we said we can contribute, this facility is a facility owned by Health System Trust, which is an agency which we fund. So we have this free of charge. So what we have said is that things like those, fewer travels, meetings must be virtual where possible. If not virtual, it must be in venues where there will not be any cost. So those kind of things we should do. But of course, you know that the biggest expenditure in the health sector, just like in education, is human resources. So one of the areas where we're going to feel the pinch is the fact that, as an example, I mean, a major key pressure for us is the fact that there's an agreement of a salary increase, which was signed with the unions in March, of a 7.5%. Within the health sector total, that amounts to about 8 billion rand, new, that increase. I'm talking health sector broad, not national, but just broadly. So, because there is no additional funding, it means that the health sector has to find the funding of that increase in salary. So, within the existing, and there's no increase in budget. We must surrender these things which I'm mentioning. We have costed, and I'm not at liberty because it's still a discussion now. But we sat down, we have looked at what we can then offer to return. And we have asked also, and I must even without mentioning magnitude, a number of our entities have also made sacrifices. You know, your National Health Laboratory, they've looked at areas they can cut, Medical Research Council, Office of Health Standards, Council for Medical Schemes, all those entities have also offered certain reductions of things which they can cut, which will then, once we have put everything together, will contribute into the fiscus reduction of the costs. There are indications, nevertheless, that because, so the salary part is going to be a big issue because we must find that 8 billion within existing. So it means it's unavoidable that certain posts won't be filled if you're going to carry through up to the end of the financial year. But there also does look like it is unavoidable also that even some core functions, we have to look at where, you would know that every year when we report at the end of the financial year, there will be some poor performance of certain functions, including sometimes, unfortunately, core issues like infrastructure, where budgets have been allocated and for various reasons, the poor management of supply chain, some funds are not. So we're looking at all those areas, even though some of them are core, to see where they can be possibly from the history and also from current trends, if there are possibilities of saving even at some of those core, so that we can make further contribution. But with the caution to try as much as possible to avoid serious collapse of the service. So that's really our approach. It's very difficult, but we're trying because we do understand that even though we're a sensitive key, service department, if there is serious, difficulties on the finances of the country, we must also find some ways, as long as there's an understanding that there's a limit as to how far a sector like health can contribute towards minimizing pressure on the fiscus. On the vaccines, the reality here, even though I was part of the team as a deputy minister at the time in 2020 when this crisis hit us. You would know, Mark and other colleagues here, that this was something which was, no one ever anticipated. It hit us. No one could predict how it's going to develop. And then, of course, the vaccines came to the scene thanks to the scientists and all the people who did research and came with this. But then when it came, the countries which had put up front, the richer countries like US, Europe, were put money up front, then, took whatever was available immediately. And we had to hustle. And we're between what is called what do they say? The devil and the deep sea. Yes. If you would remember, in the beginning of 2021, the scream, and understandable because, people were dying and falling sick, and the wave and the wave and the wave. And the scream was, where are the vaccines? So, our team at the time, led by Minister Mkhize and the Treasury and everybody, had to scramble, led by the President as well, have even midnight meetings, pleading with these companies which had stocks, talking to presidents of countries like US, UK, other European countries, and so on, EU, who have the vaccines, and all those companies. And to be, one was part of some of the discussions. And we actually held at Ransom I mean, to say, in fact, I remember, I mean, Pfizer, I mean, there was one very late meeting with Pfizer, and, you know, and that was late in 2020. As people then accused us of saying you didn't negotiate, you only came last minute. I mean, it might have been around September, October when it became clear that there's some progress in the development of vaccines. And Pfizer made it very clear that they needed an upfront deposit of a couple of hundreds of millions of US dollars, you know, if we're to be in the front of when at the time, it was not yet, the vaccines were not yet there. But there were conditions where that the only way when the vaccine actually becomes available, because they believe it's just around to be finalized, and you put the money in front, and some of which some can be refundable, some will not be refundable. You put the money up front, and then we said we don't have that kind of money. Discussed also with Treasury and said no, but you know, there are so many companies which are doing the investigation, and that's why the only upfront payment which was done was with the COVAX, and we said at least with COVAX under WHO, COVAX had brought the risk was on the COVAX facility itself, and it included AstraZeneca, J&J, Pfizer, Moderna. All of them were now contracted. So you are not putting the country's fiscus into putting money into one company. So the little bit which we could put, we put into the COVAX facility. So the fact of the matter is that we're basically at ransom to say it's either you put the money at this price, we can give you at $10 a dose, others at $6, and AstraZeneca and all this, take it or leave it. And also our also disadvantage as South Africa is that you under COVAX you also have Gavi, which is a under WHO body on vaccines, but we are classified as a middle to high income country, so we also did not qualify for subsidies and free vaccines by bodies such as Gavi under the COVAX facility. So we had to put out money. So that's really, you know, I mean, in retrospect, we can be faulted, we accept the fault, but you were held at ransom in a way.
You spoke on the cultural issues, and we've had IMASA coming out saying, the Islamic Muslim Association of South Africa, saying that the new rules are unfair to Muslim nurses. You spoke around that these are issues that have already been there. So what is the current protocol for women that do adhere to hijab and covering their head when they go into certain areas? I think I want clarity on what has already been put into place, because they're already working and they're already covered right now. So what is the change, and how is infection control then being done right now to ensure that they are adhering to safety protocols, but also religious? You spoke also around infrastructure and the plans that are coming into place. Those, you said, you know, budgets are being allocated and there are plans in place, but in the interim right now, I mean, the issues around water is not new. We've had water issues in many Joburg hospitals for like the last decade. You have load shedding coming in consistently. How do we ensure that healthcare and you know, hospitals still can run, and those that come in are still getting healthcare? And then I want to ask around the Joburg fire that happened. We've had bodies that were still being claimed. Do we have a number of how many are still being identified and are still in the mortuary? Why I'm asking specifically is around that we have more than 4,000 unidentified bodies that are unclaimed in South Africa, which put a burden on the mortuaries and on the paupers of funerals that have to take place. With this number, How many, we know that there was supposed to be DNA testing being done, it was a process. Where are we on that? I think those are my questions for now, and then we can go on more.
Okay. Look, I've had this complaint about, that's why I mentioned cultural and religious. I must say, you know, it surprised me because as much as I haven't checked whether there's any proposed, I mean, I know that when the chief nursing officer presented to us at the National Health Council, she did mention specifically about the what is yeah. She did mention that there was issues around this part, but she didn't mention anything about the Muslim dressing. So as to what, but just from my own experience, well, I mean, I've worked in Durban. I mean, I schooled and did my training at King Edward. I know it has changed the name now, in Durban, at which there would be, you know, in Durban there's also a Muslim community among the Indian community. Just anecdotally, I mean, without actually, it's something which we can also come back to you, just to check whether, as I say, this one was mentioned in the presentation on the cultural issues. But I mean, and there are those cultural things which you can take off. I mean, like the things which you put, the chains and so on. Those ones are easier. I think the problem becomes the one which you, once it's attached, you cannot remove it. But sure. Can you just give me 1 second? You know, when the Minister of Finance calls.
It's the money calling.
Just 1 minute. I might get my budget cut.
On your second part? On your first part? No, I'm saying you can delete your first part.
Yeah.
Yes, whatever you were saying. Yes.
The policy was developed and focused on wearing of headscarves and traditional adornments, which would include this spank. The inputs and comments have been received and considered. However, the meeting where the stakeholders met resolved that headscarves and traditional adornments should not be allowed on duty. However, the staff members may wear their adornments when they leave home. And so you can wear them when you leave home. Then what it means is, because there's always where people can store their goods. In the ward, there's a nurse station. So you can have a lockable place where you can store your things. They may wear their headscarves on their way to work and when they leave the work, but not inside. But notwithstanding this, I was saying that what the issue is going to be, why now?
Why now?
Yeah.
And
what has been the now I'm also just telling you the practical thing of my own experience in terms of knowing that this is the protocols. Certain parts, especially, for instance, a staff member who is in outpatients, who is doing screening, having Ispandla may not be an issue. I mean, of course, if there's a particular ruling which is agreed, but somebody who receives patients as they come, doing what they call triage, doing just screening and saying, you go here, you go there, some of those things may not be. But for instance, especially things which, the key issue also here is things which can be concealed, you know, something which, which if you, of course, if you're wearing short sleeve, it will always show. But if you're wearing long sleeve, it can also be covered so that it also doesn't say anything, I mean, to the patient, you know, whatever the patient believes or whatever. But in fact, from the infection control in those areas, it may not be a key issue, but they become a key issue if you are in ICU, if you are in the theater, if you are in the isolation ward where there is infection. For instance, if we talk about COVID, because you remember that when there's a highly infectious disease like COVID, when you go in there, you also change. You put on those funny things like the astronaut, you know. So that the issue there is that, except for things which you are covered, which are really covered, when you leave the infected place, there's a room where you must discard what you are wearing and leave it there so that it's either discarded, or if it must go for, I mean, in the theater, it's the staff which must then go for sterilization, you see. So that will be quite problematic with some of the adornments. What I have never known to be an issue is especially your Islamic.
So that is the one that is being.
Yes, because I'm saying in the sense that, as far as I have known in the few areas where I've worked, where there's also Muslim community, I've never been aware of that as a challenge in the sense of the people of Islamic religion insisting, whether they be any, not just nurses, but other professionals, even women doctors. I mean, I know there's a different kind of dresses. I've never been aware of whether doctor, nurse, physio, or anybody in the health environment insisting on having, I mean, a uniform which speaks to the religion. They would, if you, and I'm not even talking about just public.
Yeah.
If you can, what is the nearest private hospital here now? If you go to any of Netcare or any of the other private hospitals here, you will not find a nurse. Some of them are Muslim. You will not find one with the Islamic. And I'm sure some of you have been to some of these facilities. I'm not only talking about, I'm talking about because these are also part and parcel of conventional. And I've not been to, for instance, to Islamic hospital like in countries where are strongly Islamic religion. I don't know, because some of these uniforms are also not South African only. it's almost international, where when you come across a health professional, you know, you would, whether it's in Zambia or in US, there are certain things which are common amongst how health professionals in health facilities, you know, present themselves. I've never had it being an issue.
Has it not been an issue because it's been allowed? Because there are a lot
Where?
of female, here in South Africa, there are lots of female doctors that are completely headscarfed or wearing scrubs, and that's why it's become an issue with them, and that's why they are.
They wouldn't, for instance, they wouldn't go with that into a theater.
Wouldn't they then have a head, some covering on their
Yeah, when you go into theater, you
yes.
put a
So I
theater
think
cap.
that they don't have an issue with that, but once they're out of there, that they're not being told that, because remember that a female that covers their head doesn't, I don't cover, but they're women that cover completely.
Okay.
In and out of the, and I think that's the issue that Imasa is raising.
Yeah, no, look, that's what has puzzled me
Yeah.
to say, but why is this an issue? Because we've had, especially from an Islamic religion, we've had in some areas of the country, like Durban, some even like here in Gauteng, major parts of Cape Town.
Yeah.
You know, this has been there from time immemorial.
I was asking what is protocol right now already in place.
Yeah.
And if it's a reason for infection control, why now? I think,
Let me come back, because
That's fine.
I've not come across this as an issue in any hospital. What I've noticed is generally even people, even colleagues who I was in medical school with who were Muslim, we would wear the same thing.
yes,
When we go into a medical practice situation, they would not wear the.
Do we know what's the international standard?
In terms of religious issues.
Yeah, in terms of religious aspects of somebody who works in a hospital, do they, I mean, or here in South Africa, we've just been like doing our own thing. So,
That's why I'm saying there is.
yeah, because it just seems as though there are certain areas where this has just gone on, and it just seems like it's never been something that's been cleared up. So it's been, maybe the department is trying to clear it up now, and one of the restrictions has been that this new protocol is going to ban or is going to restrict those who observe their religious beliefs, like wearing hijabs. So it's only become an issue now because it was never really regulated before.
Well, probably never regulated, but also what may not have made it an issue is probably like my own experience, that even colleagues from the Islamic and other religions have never actually made it an issue to insist. You know, because when you get into an institution, there are certain, whether they may have been national, but there are things which, unfortunately, some of these things which we are now putting on paper have basically been conventional. You know, I mean, that's why even the renegotiation. I mean, when I trained, it was not even a question that the nurse wears white uniform. It was not even an issue, and you knew that a nurse would be in white. You know, and then somewhere down the line there was some tweaking to bring in navy blue, bring in. During those times, sometimes what I remember is that I know what in many of the hospitals, the only people who would sometimes wear, for instance, some navy blue would be the matron. You know, but because the matron is in the office, and they only come to supervise. But anybody who was in the front line from a nursing profession would be white. And any doctor would have a white coat. And it must be, even at the time, it was even compulsory, it must be a full white coat. Not even, these days you see doctors with half coats. But when I trained, it was compulsory that your coat must be below the knee and so on. And it was convention, and nobody questioned it. I think with the kind of society now where also the issue of human rights, religious rights, some of these things, and traditional cultural rights, these things then come where people now start to question, but why should I take off my scarf, my what, and so on, when all along anybody who, even if you're a Muslim, if you accepted the job to be a nurse, you were told this is a uniform. And also it might be, you know, if you think of it, it might be before your time, but during my time, nurses also had some, there was also some kind of a hat, the white hat, so which would have also would have looked after even women of a Muslim, because all nurses would have a white hat on their head.
Bring back the white hats.
Yeah.
You what?
Bring back the white hats.
Was a piece of paper, white paper.
We've seen a practice with many celebrities undergoing the traditional healer training.
Yes.
If if it's a nurse who have undergone that, then remember some of them, they have to put that red look on top of them. So then you can create the problem, say, no, why do I have to take off my look, but the other one is not doing it. So it's
I think those are also.
Yeah. But yeah, I think maybe just in terms of the explanation about these negotiations, maybe do not cover the question of what makes it an issue.
Yes, I think that's,
that's the thing.
I think that's where there is a conversation coming out where does it come across as being Islamophobic, or I think that's where the concern is also coming about from the nurses that are of Muslim faith, that feeling that this may be just discrimination specifically on them and not just a protocol on infectious control.
Okay. Yeah. The issues about infrastructure, as I've said, you know, it's true that there would be challenges of water and electricity. I think it's the intensity of some of these problems which creates the sort of a crisis, because even if you take water, it will be very rare. I mean, sort of, it would happen once in a while that there is water interruption. In especially, you know, it would mainly be in some of the rural hospitals, which depends on boreholes and also some very kind of insecure water supply, but not in big urban areas. Generally, the issues like that. And why it is now becoming a focus is because, as I said, there is also the relationship in these big urban areas like Johannesburg between the electricity problem and the water problem. Because on the one hand, of course, as you would have heard Rand Water saying that there is pressure on their own water supplies, because their own storage pumps and so on, with the growth of the cities and so on, they don't have, you know, on their own adequate, even though, I mean, I think in the last few days they did come forward to say, even when you may think, because the dams are 100%, but is the infrastructure. And also because, remember, the health facilities share in the same way as electricity. The water which goes to Rahima Musa is the same water which services that part of Johannesburg, which the community. So, if there is a pressure on the storage, on the pumping of water, and the purification of the system and all that, it also affects the hospital. It just says that, I mean, the reality is that our health facilities are not insulated from the problems which affect the local communities in terms of your bulk services, because historically there are certain things which you take for granted, that while you must prepare for emergencies, just like the power, you know, a health facility is not expected to be so independent on everything of bulk services, such that it can exist as an island. It's part and parcel of the infrastructure which services the area. So it suffers. So that's why you would find that even though there will be some storage for water, it will be anticipated for a few hours, but not to say a whole day, 2 days, where there's a water issue. But then that's why I'm saying over time, they have been there, but they have not been of this kind of intensity. And that's why it now compels us to divert some of the budget infrastructure from looking after our core business, which nobody else can look after. I mean, our core business is, you know, do you have a proper ward with all the equipment for medical care, medicines, all that, X-ray machines and all that. You take it for granted that the bulk services, which include the sewer services, the water, the electricity, you are just a consumer. There's an authority which is a higher authority on those services. The problem becomes when there's a problem with that higher authority, which is the specialist in those areas. Then you must then create your own kind of protection. The Joburg fire, I must admit that I haven't had an update in terms of the number of bodies which have been verified. There has been some update up to some stage in terms of the process moving with the DNA identification, and I think also because one was away for some time over the last week, one was not able to get a full update in terms of how the process has gone. So I'm unfortunately not in a position to can give you an accurate, and I'm sure it's something which through the team here we can be able to, before the end of the day, come back to you to say this is the update. The unclaimed bodies, it's a problem, and as you would have heard us from the parliamentary response, it also very much dependent on other factors. One, it's of course some of it is on the police side in terms of the DNA testing, biometric also. If it's unclaimed bodies, I mean, you need to find somebody who would come and say there's somebody missing, and then that's when you can take a sample, just like it's happening with the Joburg, because DNA depends on matching to say there's somebody missing, and then of this kind and so on, especially in a situation where, because the complication with the fire is that its bodies are beyond recognition. But if it's just unclaimed, it means that the family member would be able to say, I'm missing, a male person of this age, and so on and so on and so on. Then you are able to physically match. You can also take biometric samples and be able to check on that. But at the end, when all that has failed, is the issue of what is called the pauper's funeral, which must be approved by the municipalities. And that's why on this one also, but it includes a police clearance, because you have to also exclude the fact that there is no issues around crime and by the time a body is cleared for state burial, it must be that there is no issues of possible criminality, and once that is, and then that report goes to the municipality, must get the approval, and then you can be able to process. So it's an issue on which is a pressure on our state mortuaries, but it's not a matter which just pathologists and health officials can make a decision to say this body has been here and therefore we're going to go this route. It must, all these parties must approve that process.
Okay. Huh? It's a team. Are we done, colleagues? No one is interested in asking any questions?
I just want to follow up. I'm not sure if you answered it with Mr. Haywood. With regards to the vaccines, I saw an article around about 3 million rands worth of vaccines that are going to be destroyed. The COVID-19 vaccines. Can they not be resold? So we
To
can
who?
get our money back. I don't know to who, but do they?
Who wants a vaccine in which country? Tell us. We are ready to sell.
We don't want donation.
Not even selling, donation. But no, look, the fact of the matter, as I was saying to Mark, is that the fact of the matter is that we all were under this pressure. We had to. Nobody could predict what's going to happen. I mean, speculations were rife, even from scientists. I mean, you would have had even our top scientist at the time, Professor Karim, will tell you that, look, this is what we suspect is going to be the next. But I issue a disclaimer. It's not 100% because no one, even the top scientists at WHO, would be able to predict what was going to be next. So we had to be ready, and of course, our disadvantage was that at the time when people really wanted vaccines at the beginning, they were all in Europe and America, and they even stocked for 3 times their population. And by the time they started even giving us donations, it was the same time that the strength of the disease was getting lower. I mean, we had the outbreak in December of 2021, which scared a bit, and people came for vaccination. But within a few weeks, we ourselves have to report that it's not as deadly as the previous waves. And once you say that, people say, they say it's not as deadly. Then, especially the young people, they just don't come. But we had to be ready. You can imagine if the opposite had happened, that the wave after wave, and there were now even young people were scared, and they wanted the vaccine, and we didn't have. Like there were times when J&J could not deliver after we have already paid for them because there was a problem in America in their manufacturing where there was some contamination, if you may remember. So there were months when J&J couldn't give us vaccine because there was a contamination in their plants in the US, and then they delivered late. So we had to use only Pfizer vaccine at the time. Fortunately, Pfizer vaccine was there. With all those things, I mean, and then we have got millions of vaccines in the fridges. And then we plead to keep on spreading the message, but people say, they say, take off the mask. You don't know, you don't need the mask anymore. You can go to the soccer match, you can do what, you can have your church service. So what do you want the vaccine for? So, I mean, we had to be ready, but now we have the same problem. I mean, we meet with even just local. I mean, the other time I was talking to the minister of Eswatini. Hey, don't you need vaccines? She says, oh, no. We have our own vaccines, and nobody wants them. So you go to all these meetings, and you offer. And they tell you we have the same problem. We have stocks of these vaccines, and no one anymore wants them. So, I mean, it was just, I mean, security. It was health security issue. Unfortunately, well, let's say fortunately, we reached the stage where COVID was no more a serious a public health threat. You still have flare-ups here and there. I mean, you know, even about a month ago, our DG had COVID, you know. But I mean, he was at home for 3 days, just at home, and within a few days he was able to be back. So he's still there, but nobody really, almost like as was predicted, it's almost like a flu. It's still a serious flu. It can kill you if you've got other comorbidities, but it's not. So there is no real incentive, you know. No matter we have our message on the radio that it's free, you can come and so on. People don't test. I mean, even when they have a respiratory problem, it's a flu. Nobody wants to be told it's COVID, so they don't even want the test. You see, so that's the reality. So as a result, I mean, we honestly, I mean, we've lost money. We're still losing. I mean, we have destroyed about 20 million doses of Johnson & Johnson vaccines. They've been destroyed. And because we tried to negotiate, because they delivered, I mean, the contract had been signed. As I said, there was a delay, but while the contract had been signed and they delivered, and we tried to renegotiate to say, don't deliver, refund us, because people are no more taking. And they said, no, we've got a contract that you take this 20 million. We knew that there was nobody still coming forward. And now, part of then the problem, we're keeping some in the fridges. But when there's a huge consignment like that, even coming at a time when there was very little uptake, the problem is to acquire additional fridges. Because there's companies which we rent because we specialize in these things, including BioVac has been storing some. But we pay. So when we then look at the costs on a daily basis of further storage in the fridges when there's no one coming, we'd rather cut our costs by formally destroying them so that we don't incur further costs. So we're talking about something like 2 billion rand, not million, yeah, but yeah, which.
Can I ask someone one question? Given the cost containment measures or the instruction advisories that's been put in, and being that human resources is your biggest salary bill, could public health sector see a Section 189 process coming in?
Of retrenchment?
Yes.
No. I mean, we would defend that. Would not. I mean, that will be very, very, very last, and we will by all means avoid that. The thing which is still a problem is that, for instance, as you would know, where there had been temporary contracts for people who were employed under COVID, many of those have not been extended. There are a few who have still been kept. Some have been absorbed into some of the staff would have been absorbed, but so where there's still people on short-term contracts, that's where, for instance, we might not be able to keep further, renewal of the contracts, except where permanent posts then are vacant, and some of the, especially professional staff and even support staff, because in a clinic, in a hospital, if you don't have a clerk, it can jam everything. I mean, during the strike, I mean, I went to Mokgwerane Hospital, and we managed to get a number of professionals back. including army nurses and doctors, but there were no clerks, and patients were stuck because you must go and retrieve files. So what I'm saying, when you talk about key staff, it doesn't only mean the professional health care like nurses, doctors, physios, and so on, even admin, including, porters in the hospital, those who move patients from one place to another. So there are all those. These are all permanent positions. Mm-hmm. So we will really do everything in our power to make sure that people who are in permanent positions, we never reach 189, which is about applying for retrenchment. It's not an option. The reality, nevertheless, will be that where there is some unfilled vacant posts, as people retire and so on, and that's why I'm saying one is crossing fingers that this is temporary, that there will be stability, a regain of stability in the finances, so that come the next financial year, if it's and I can tell, I was saying to some of the team yesterday that maybe one has been in the public service for too long. I've gone through this many years ago, when I was in Limpopo, in the early part of the democratic administration, and because we forget these things. At that time, it might have been, I suspect, I was an MEC in Limpopo at the time, probably around 95, 96, when President Mandela was president. He just gave orders. The fiscus is under stress. This is not going to happen. It did not only stop there, but he then also gave an instruction, you must have salary reduction. All of us who are members of parliament, we had to have 5% cut. Not prevent an increase, but he ordered that we all have a cut, and we all have to have a cut in the salary. It was somewhere around 95, 96, and then there was a recovery. We saved money, and there was a recovery, and we were able to carry on. But a retrenchment of permanent staff, we're not going to entertain that. We might struggle with filling posts where people have retired, have died, and so on, delay for some time. But also, we also have, as a health department, statutory requirement. One, intense, medical graduates who qualify, those who would qualify end of this year, and those who qualify, those who, there has been a story about some unemployed graduates. We have absorbed all those. It's a statutory requirement. Any student who qualifies and is a citizen of South Africa, it's a requirement that they must do internship, and it's a state responsibility. So we must create those posts, we must fund them. Secondly, in the medical side and also in nursing, there's also not the internship, but community service. It's also a statutory requirement, because those graduates, they can't go and work on their own until they've done those. So those are things which are non-negotiable. Yeah.
Okay, thank you very much. I think we've come to the end of the engagement. From our side, communication team, we would be happy if you colleagues could give us some bit of a feedback so that we can improve on it, but we want to have this kind of an engagement time and again, so that you get more of what the minister is busy with, and then also to clarify some of the other things that we might be needing a lot of information about. Thank you very much.
Thank you. Thanks from my side as well.
Oh, no. We didn't have that. Yeah.